Good afternoon. This is Carmel Angelo, Mendocino County CEO, and this is our Friday afternoon COVID-19 update with Dr. Noemi Doohan. So in just a few moments, Dr. Doohan will be giving you the update for this week and what to look forward to over the next couple weeks. But before we do that, I would like to report that our numbers of OptumServe testing have gone up, and we are over 86% full every day. And again, Optum is Tuesday through Saturday, 7 a.m. to 7 p.m. And so we would like to thank Mendocino County residents for understanding the importance of testing at this time and making their appointments and going in and getting tested. Thank you. For those of you that have not called Optum or have texted have gone onto the website to make an appointment, let me give you the web address, which is lhi.care. And you can go onto that website and make an appointment to get a COVID-19 test, or you could call this number to make an appointment to get a test. And that number is 1-888-634-1122. Additionally, Mendocino County still has a call center, and that's a number that any resident could call to get information about our COVID-19 event or services. And that number is 707-234-6052. And lastly, under the direction of Dr. Janine Miller, Behavioral Health started a warm line, which is a non-crisis support number for the public. And that number is 707-472-2311. And the warm line is open Monday through Saturday, 7:30 a.m. to 6 p.m. So those are some key phone numbers and contact information for our residents here. So at this point in time, I would like to go ahead and turn the update over to Dr. Doohan. Thank you.
Greetings, Mendocino County. I'm your health officer, Dr. Doohan. And today I want to start by giving you updates about the number of cases, COVID-19 cases in Mendocino County. So we have, as of today, 39 cases, and we will be putting those up on our tracker later today. So if you go online onto our county website, you can see some of the breakdown of the demographics of these cases. And one of the things that you'll note when you go to the tracker is that the vast majority of these cases are in the region that we define as Ukiah Valley. So of the 39 cases, we are, of course, some of those are old cases which have fully recovered, and we're very grateful for that. We're very grateful for the fact that we have no deaths in Mendocino County from COVID-19, and that of the 39 cases, 4 were hospitalized, but all 4 of those individuals have been released from the hospital and are recovered or recovering. So that's very good news for our county. Of the people that are cases that are still active, meaning they still are within the isolation period of COVID-19, which in general you can think of as being 10 days from the date of the positive test. We have 1 case in isolation on the North Coast area and 6 cases in isolation in the Ukiah Valley region. So these are individuals who have a positive test for COVID-19 and are still in that active period of the disease within 10 days from their positive test. We also have a number of people in quarantine in our county. Now, these quarantined individuals would not be shown on the tracker. These are people that are not sick, but have been close contacts of a case. A close contact in Mendocino County we define as being for 10 minutes within 6 feet. So at least 10 minutes within 6 feet of proximity to another person. And so we have a number of people on quarantine who fit this in Mendocino County. Now, an individual who's had a close contact is in quarantine for 14 days from that date of close contact with a known case. So in quarantine, we have 1 individual on the South Coast, we have 3 individuals on the North Coast, and 22 individuals in the Ukiah Valley. I have not presented data to you before about individuals that are in quarantine, but I'm doing that as of today because I want you to have a sense, Mendocino County, that in our public health response, we're not only daily following up of our cases on isolation, we also daily are focusing and following up on the individuals that are quarantined. These quarantined individuals are not sick, but if they were to become sick, and we do call them every day, they would then be encouraged to go in for testing with their healthcare provider or at the hospital if they don't have access to primary care. So again, we have 1 person quarantined on South Coast, 3 on the North Coast, and 22 in Ukiah Valley. And then again, that is for a 14-day period. From the evidence that we have, based on the cases that we have community spread in the Ukiah Valley. We are not seeing evidence of community spread actively occurring in any other part of our county at this time. Because we have community spread in Ukiah Valley, this is why we are so grateful for the resource provided by OptumServe, which is a free drive-through facility at the fairgrounds in Ukiah, where individuals can go to be tested, and this is helping with our surveillance testing capacity. Now, regarding testing, there are 3 types of testing that we do in our county, or in any county for that matter. There's surveillance testing. Surveillance is for people that are not sick, and we're really sampling the community to see if we find any hidden cases of COVID-19 in people that are not having symptoms. Regarding surveillance testing, we have done over 3,900 surveillance tests in our county, and through that have come up with 15 positives. The majority of those positives are from OptumServe. So that is a 0.4% positivity rate through surveillance. That means that 4 people out of 1,000 tested positive, and the principle of surveillance is these were people that were not sick. They could have been pre-symptomatic, in other words, they were going to get sick later on, or they could be asymptomatic COVID carriers. So that is to just give you a sense that you have to do 1,000 tests before we find 4 positives. This is why surveillance testing is important to do on a daily basis. We do it in Ukiah Valley 5 days a week, and to try and do 132 tests every day, which is what our goal is for in order to continue using OptumServe. But surveillance testing is for people that are not sick, to get a sense of how prevalent is this infection in our community. And we have currently 4 out of 1,000 that have tested positive through surveillance testing. The other type of testing that we do is outbreak testing. This is when we find a case and we do the case investigation, contact tracing, and then we really try and focus on those close contacts and make sure that we can contain the outbreak by testing all of the close contacts, putting them in quarantine, making sure the positives are in isolation. This is what we've been doing for many months in in Mendocino County. And this is how we've contained outbreaks, which we have. Every single time we have contained the outbreak. The evidence of that is as we do surveillance around those areas, we don't see new cases popping up. There was an outbreak that we're concerned about in Mendocino County, which we don't know that there has been an outbreak, but there was a case last week, which is an individual who's been very responsible and very cooperative in terms of sharing all the information that they have with us. It's a case of community spread. They don't know where they got the COVID, but they shared information with us. And through that information, we found out that there was a graduation party with over 20 people in the Ukiah Valley at the end of May, where people were not social distancing or wearing facial coverings. So we urge anybody that's been at a graduation party in the Ukiah Valley that did not social distance, that was on the larger size, I'm talking about over 20 people, please go for testing at OptumServe at the fairgrounds if you're not sick, or seek medical care if you are. The third category of testing, the first being surveillance, the second being outbreaks. The third is if you're sick. Sick people in our county have been able to get tested and cared for in our excellent community clinics and clinics that are around our county and in our hospitals. So for those people who are sick, we continue to urge you, call ahead if you're able to, and go and get medical attention, and you can be tested when you're sick in our great clinics and hospitals. And in fact, that is how we've found the majority of our cases, is through people who've been sick and sought medical care. We do have in our county public health response to COVID-19 isolation and quarantine housing. This is housing where we can put people, in particular it's been in motels, if they don't have other safe housing available to them. And so this is a program that we've been doing now for months, and we are able to safely isolate or quarantine people in motels. And we also have other facilities like Whitmore Lane and Ukiah, where we can provide additional isolation or quarantine housing if needed. We also have blanket isolation and quarantine orders, which states that anybody in Mendocino County who's tested positive for COVID-19 must be in isolation according to the health officer's orders, which you can find on our website. Or if they are a close contact, they must stay in quarantine for 14 days. These are blanket orders. We also have our process of doing case investigation contact tracing, and we've done many trainings on this, 3 trainings for our team, and this is underway every day, practically, not every day necessarily, but certainly many weekends, but during the week, anytime that we have a new case, we're doing case investigation contact tracing. I bring this up because it's related to some big news of today, which is the governor last week announced that lodging could open in all counties across California that are variance counties that have successfully gone through attestation, which we did in Mendocino County as soon as it was possible, and we did it very quickly and promptly and achieved a very high rating in terms of our ability to become a variance county. Well, one of the things that you'll find if you look at the new orders that are on our website, they've posted now, is that for lodging, there is a requirement in my orders that the lodging reserve 25% of their rooms for the potential that there might be a case of COVID that comes in from somebody that's in the hotel, or that there might need to be quarantining of an individual who tests positive for COVID-19 while they're in that hotel, and their close contacts might need to be quarantined. So in my new orders, it really is opening up lodging, but there is this stipulation that 25% of the rooms must be held back for the potential to need them for isolation and quarantine housing. There's also the stipulation that rooms, before they're been rented to a new person, must have a 24-hour period where there is cleaning allowed. And not just cleaning, but you need to have some time before the cleaning people can come into the room safely. The governor has stated that there should be 24 hours or 24 to 72 hours that we allow lodging to have a cleaning period in between guests. So that is also in the order, a 24-hour period between guests occupying a room to allow sufficient time for the individuals who are cleaning to safely enter the room. Regarding modeling, this continues to be a priority across our state and in our region to be able to predict what might be coming with COVID-19. So this week, the governor released some of his modeling data, and I want to summarize some of the high points, or let's say the key points from that modeling data that the governor has released. There is a prediction that there will be a second wave of COVID-19 in the fall around Labor Day. We don't know exactly the details of what this surge will mean, but we know that it indicates that there'll be greater cases that will put a greater impact on our healthcare systems. We also have learned that surveillance testing, which I mentioned a moment ago, increases the accuracy of our modeling. And this is why in Mendocino County, we have made a strong commitment to continue surveillance testing with OptumServe and other resources that we've had up to this point. And towards the end of June, we have UCSF free testing, which we are fully utilizing to the extent that we can. The surveillance testing is not only important for the Ukiah Valley, although this is where we're seeing the majority of the cases and community spread. It's important for an entire county. And this is a commitment that we have in the public health department to make sure there is surveillance testing in our entire county of people that are not sick again, but that we want to do sampling to see that we have a good sense of the presence of COVID in those populations. We will get, the other statement that came from the state is that we will get better at predicting as we go farther along into this pandemic. And the predicting, for example, would allow us to say, well, what did opening up lodging do to the number of cases in our county? Right now, we wouldn't be able to say that. We would only be able to say in large kind of sweeping terms that we saw specific numbers of cases occurring, but we wouldn't know that it came specifically, for example, from lodging. But this is what we hope will come in the future with the modeling power that we're going to be getting from the state. The other thing the state has messaged is that sheltering in place has flattened the curve and slowed the spread. There's clear evidence of that, as well as wearing facial coverings, social distancing, all of the other things that we've done to protect us all from COVID. What we call the non-pharmaceutical interventions, or the NPIs, have been very effective. And in fact, looking back, the governor has stated that the actions in March that we took to shelter in place saved thousands of Californians in May. I do want to speak to tourism. The question is, with my new orders, have I opened up tourism? And the answer is no. My new orders have not opened up tourism. What my new orders have done is opened up lodging and opened up recreation to a greater extent. I do want to remind Mendocino County that the governor's orders are always more I can only be more restrictive, not less restrictive than the governor's orders, so we must follow the governor's orders. And the current state orders require people to, and I'm going to quote, avoid traveling long distances for vacations or pleasure as much as possible, end quote. So the governor is still putting a restriction on traveling to the extent possible. For keeping it to essential or urgent causes, we do still have a sheltering in place order from the state. So again, we have opened up lodging. There are restrictions that I've mentioned, and there's nowhere in my order that I'm saying tourism is open, okay? And regarding Mendocino County, we do have a restriction within Mendocino County that we are asking people to limit their travel to 50 miles straight line on a map to the extent possible for those recreational purposes or those higher risk businesses. So example, what is a higher risk business? That might be going to a hotel on the coast if you live in the Ukiah Valley. That is allowed travel of 50 miles straight line on a map for our county, but we wanted you to try and restrict that to the extent possible because we still are living within a pandemic. Businesses are not required to police how far or how much their customers travel. Businesses are required to inform customers of the need to social distances, to the need to social distance, the need to wear a facial covering, and to comply with hygiene protocols. So again, businesses are not required to police how far or how much their customers travel. The sheltering in place orders that I'm releasing today come into effect at 3 p.m. today, and they have an end time of 3 p.m. on July 3rd. My anticipation is that on July 3rd, my new orders will be much shorter than prior orders. These new orders that I anticipate releasing on July 3rd will refer largely to the governor's orders and to the state orders which are still in place. But there will be certain elements that remain in these new sheltering in place orders after July 3rd. And I'm not going to say exactly what those are now, but I would comment, for example, that facial coverings, there is a facial covering in public order that will still remain. There are orders about social distancing in guidances, for example, for businesses, that these will still remain. But what you would anticipate seeing on July 3rd, when these current orders that came into place today are shorter orders, mostly referring to the state governor's orders. Regarding the higher risk businesses that the governor allowed to open up last Friday, which allowed us to enter into stage 3 of the pandemic, these higher risk businesses, with, for example, gyms, bars, wineries, and lodging, are going to have a site-specific protection plan and a site-specific protection plan, which is actually a written document that in the order, it specifies that this is a document that will be kept on site at that business and will be submitted upon request, that specifies how that business will make sure that people that come into the business are safe. For example, how can people wash their hands? How can people be assured that social distancing protocols are maintained, and so on. So that is all specified in the new order, and we have a summary document coming out today that summarizes all of the changes that are in the sheltering in place order. The health officers across California only got word that the governor was going to allow various counties to go into stage 3 on Friday of last week. We had a week to prepare. We did so, those of us that did enter into stage 3 today, focused with great attention all week on how to do this safely. The governor's order that allowed us to open into stage 3 specifies that we must do so keeping in mind what is actually happening in our county in terms of the spread of COVID. We are still not out of danger by any means. We expect a surge in the fall. We are seeing cases about one a day at this time. So it seems that every day I'm hearing about a new case, most of them centered in Ukiah Valley. There is no slowing down at this time of this pandemic. So we must be careful. We must continue to wear our facial coverings. We must continue to social distance, wash our hands, and stay home when we're sick. All the things that we've been learning to do over these last months. So I think that's it for me now. And I would ask Sarah Duquette, our PIO, to open up the lines for our excellent journalists and reporters so we can share information with our public. Thank you, Sarah.
First up, we have KZYX with Sarah Rice. Sarah, you're live on the air. Sarah, you're muted.
As we open up, I'm wondering if there is some changing advice on how often people should be tested. For example, if we've been going to demonstrations, if people are going back to the gym, if people are starting to participate in the activities that are now allowed, should people be getting tested more often than the 8 weeks that were recommended?
Yeah, thank you, Sarah. That's a great question. My answer would be that to the extent that individuals are wearing facial coverings, that they're staying home when they're sick, that they're social distancing, that they're washing their hands frequently, especially when they touch any surface in public. For example, I've wiped this down. I will wash my hands afterwards. I'll avoid touching my face, and so on and so forth. As long as you're following these hygiene rules and social distancing rules and wearing facial coverings, even when you go into these businesses, such as a higher risk business like a gym, my assumption is that those businesses will be operating safely and will allow you to go into that business without putting yourself at great risk. And therefore, testing once every 8 weeks would be the right amount of time for the general public. If you are somebody that is in a more high contact area, like let's say a grocery store clerk that's having a lot of contact with individuals in the public, this would be an individual that I would suggest is tested once a month with surveillance testing. We're talking about surveillance testing, people that are not sick. And then for people that are in the higher risk category, like workers in skilled nursing facilities, they are actually 1 month as well. But we could, if let's say we had an outbreak in a skilled nursing facility, which I hope we'll never have, then we would go to the higher frequency of testing for those facility workers of every 2 weeks. That I would suggest is tested once a month with surveillance testing. I'm getting some feedback. Not sick. And then for people that are in the higher risk category, we're hearing feedback with the audio. In skilled nursing facilities,
Sarah?
Actually 1 month.
You're ready for your second question, and if you can please mute the feed in the background.
Okay.
Then we go to the higher frequency of testing.
Sarah, do you have a second question? Sarah, do you have a second question? Sarah? You're ready for your second question, and if you can please mute the feed in the background.
I think I have muted the feed in the background. That's all I've got.
Okay, thank you.
I'd like to just follow up is that it's my hope that we will continue to be able to do this frequency of surveillance testing. Of course, the future is unknown in this pandemic, and so we will continue to do everything we can at the level of our county and our DOC to make sure that we have that frequency of testing available in our county. Currently, we do have that in the Ukiah Valley, and I do want to acknowledge that we're working to create more capacity in our outlying areas of our county. So this remains a priority to us. Thank you.
Next up, we have Matt with KMUD.
Hey, y'all. Thank you for hosting today. My first question is for Dr. Doohan. So with the numbers of community spread trickling up, I'm wondering if contact tracing has been able to determine what sort of facilities this community spread is occurring within. I'm sure you can't be specific as to what facilities those might be. And if not, in light of reopenings, what sort of facilities do you see as the most potent transmission sites for the virus?
Thank you, Matt. So in terms of community spread, I will tell you that the cases that we have of community spread, there's no relationship between them. And that's what you find with community spread. You just don't know where that person got the infection. In the beginning of this pandemic, I would say, oh, it was often frequently the same thing. This is an individual who traveled outside of the county. They know they were in New York. They came back. They had COVID. It wasn't from our community. The newer cases of community spread, we do the case investigation. They didn't travel anywhere, and they didn't seem to have any contacts that indicated where they got it. And of the cases that we have of community spread, they're not related at all. And they're not particularly in any areas that I would call high risk. We do the case investigation contact tracing for every case that we have. And from that, we find groupings of people that we get more concerned about, like I mentioned, the graduation party. And then we would reach out to the graduation party and say, please, everyone get tested. From that, we've not found any outbreaks from any of these cases of community spread at this time. So I'm not seeing any trends in the community spread at this time. They're really not connected, and they're not anything that puts up alarm bells for me either. It indicates to me that COVID is out there in our community, and we just need to wear those facial coverings, keep the hygiene principles and social distance. I was on a call this week with the state where it was shared that this is hard for me to say, and I don't want it to be misunderstood, okay? But one of the riskiest things that we can do is sing in a closed space together. So singing seems to be one of the most dangerous things that we can do with COVID. Because of the pre-symptomatic period, which can be 48 hours before someone gets sick, and the fact that with singing, we take deep breaths into our lungs and then we expel the air forcefully, some of the data suggests we can spread COVID 100 feet. So I would say that one of the riskiest things that we can do is sing indoors in an enclosed space. And indeed, singing itself is very risky. Any activity that we're in an enclosed space where we're deeply breathing and exhaling, I think would be very concerning. And for me, I'm very concerned about the gymnasiums. It's hard for me to imagine how we will stay safe if we're exercising in a closed room together. So I would say that it's absolutely important that people do not go to the gym when they're sick, and that they wear a facial covering, and that they make sure that when they're exercising in a gym, they're really well spaced out. And to the extent that you can exercise outside, that is much better. So if you're a yoga studio and you can have your yoga class outside, please do that, because that will be protective. So thank you.
Thanks for that, Dr. Doohan. And my second question has to do with the future of reopening schools in the fall. I'm sure you saw State Superintendent Tony Thurman's extensive document outlining the recommendations for school sites. And one thing that I found reassuring was those were recommendations that were adaptable to meet the needs of each community, the nature of the pandemic and its spread. And I'm wondering what recommendations you saw in those documents, knowing the nature of the pandemic in Mendocino County. Which ones do you think are most important to implement in K through 12 schools as they're preparing to open up?
Yeah. Well, I think when we look at the guidance that we've gotten from the state, it tends to be broad. And an example of that is with lodging, where it says in the guidance, it should be strong. I don't know the exact wording, but something like it should be strongly encouraged that we have a cleaning period from 24 to 72 hours. I mean, that's very broad. With the schools, this is very, very difficult. It's a very broad document. And the criticism of this document that comes from the state is that it may be impossible for the schools to implement what this guidance is saying should be done. So what my stance is with the schools is that I am very concerned about our children. I'm very concerned about how this pandemic is affecting our children. And we have outstanding leadership in our county. The school superintendents, the teachers, the schools themselves are so devoted to our children. And I'm going to look to them to let me know what they think will work best for our children, and I'm going to support them. So my orders never closed the schools, and my orders are not going to restrict what the schools believe is going to work best for their children. I will advocate for our schools to do what's best for our children in Mendocino County. And it's very different, high school in Ukiah Valley versus high school in Potter Valley is very, very different. So we need to also be sensitive to the different realities of our children that are living in different environments. So I want to support the school leadership in our county to make that state leadership, that state guidance work for us, for our children. Does that answer your question?
It does, Dr. Doohan. Thank you for your time today.
Thank you, Matt. Next up, we have Adrian with Mendo Voice. Adrian, you're on the air.
How you doing, Dr. Doohan?
It's Adrian.
I was wondering if you could talk a bit more about what the projections say that second wave is going to look like. Will it be bigger than the first wave? Will we be facing something in California like New York faced? If you could provide any additional details about that projection and how that might specifically apply to Mendocino County.
So Adrian, I haven't seen specific data about the surge. What I have learned is that experts that have been brought in by the state of California from different sectors all agree that anticipation is that there will be a surge. I think that the nature of that surge depends largely on what we as Californians do and what we as Mendocino County people do. Because we've absolutely seen that what we do impacts the surge. So if we all just ignore sheltering in place and we don't wear facial coverings and we don't social distance, we will see outbreaks. And importantly, the case investigation contact tracing that we do we need to continue doing that. We need to continue doing surveillance testing. We need to continue providing isolation and quarantine housing. So if we're doing those things, we will continue to slow the spread and we will continue to flatten the curve. And if we stop, we won't. I know that's not a specific answer, but I want to emphasize that what we're doing is helping. But even with these things, this modeling is saying, even with these things, we will see a surge. We don't have enough information yet. I do anticipate that in a month, so more towards the middle of July, we will see some clear evidence of what's going to happen in Mendocino County. I did not feel that it was wise to make my current orders extend beyond July 3rd. As we all know, Independence Day weekend is a big weekend for the United States, for Californians, for our county. And I want to hope that Mendocino County will be able to safely enter into Independence Day with some more freedoms, which is what I hope my next sheltering in place order will allow, some limited additional freedoms, which I'm not going to specifically say what they are now, but they will be guided by the governor. But we don't know, Adrian, but certainly all of our individual actions are going to make a difference, as we've seen already so far.
Yeah, thanks for that. Am I still live?
Yes.
Thank you for that. So it sounds to me like you're saying that really the severity of the second wave is going to depend a lot on our actions, but that second wave is to some extent inevitable.
Yes.
My second question is if you could talk about what kind of risks may be associated with large-scale protests and what kind of precautions might protesters want to be taking. You made actually, if I could ask a very tiny question, I know I'm supposed to do two, but a very short question. You said singing's very dangerous. Does that also apply to brass and woodwind instruments?
So first of all, the reason we know there's going to be another wave around Labor Day is because we're opening up. If we didn't open up, we would have flattened the curve and slowed the spread, but we must open up. So that's why we know the timing is going to roll out around then. Regarding protests, first of all, it's better that they're happening outside. So to the extent that we can have protests outside, that's protective. To the extent that people can social distance and wear facial coverings, that's protective. To the extent that they cannot go to a protest if they're sick or immunocompromised or otherwise frail, that's also protective. in terms of brass instruments, I'm not an expert, but my understanding is that the major issue with these instruments is not that they project droplets, but more that they collect saliva. But again, this is outside my area of expertise, but it's really projecting the voice. So chanting, yelling, singing close to another person would be dangerous in a large gathering. So it's better if people can be distanced apart.
So it's time for lots of string quartets.
String quartets would be better.
And in terms of the protest,
And
there have been some large protests. You haven't seen any spread. You haven't noticed any spread in surveillance testing or any of people getting sick from those protests. Does it seem that the fact that they're fairly spaced out and outside is being preventative?
In the Bay Area, my understanding is they are seeing spikes in cases from, now again, when we get better and more sophisticated with our modeling, we'll be able to ask a question like, did this protest lead to an outbreak? But at this point, it's just in the greater Bay Area, we're seeing spikes of cases that are based on the time frame we're anticipating are likely connected. Just in general, people not sheltering in place anymore. And certainly protests are an area where that is happening.
Okay. Thank you very much, Dr. Doohan.
You're welcome, Adrian.
Next up, we have Jackie Orozco with El Punto and George on the line for translation.
Thank you so much, Sarah and Dr. Doohan, for having Periódico El Punto in this press conference. Mi primera pregunta es, sabemos que el Departamento de Salud Pública está encargado de cuidar la salud de todos los habitantes del condado de Mendocino, pero en los últimos días hemos visto que las estadísticas nos han dicho que 15 de 38 personas son personas de origen latino, lo cual representa el 40% de las personas que son casos positivos con COVID-19 en el condado de Mendocino. ¿Qué otras medidas el condado está considerando tomar para difundir más la información en español, aparte de traducir algunos documentos y ponerlos en la página de internet? En nuestra experiencia, las personas que son monolingües, que solo hablan español, no están familiarizados mucho con ingresar a una página de internet y buscar la información en un website debido a la falta de destrezas para navegar en internet.
You're muted, George.
Oh, okay, sorry.
There you go.
Okay, yeah, this is a long question. I'm going to try to do my best. Okay, we know that the Department of Public Health here in Mendocino County is taking care of our health for everybody. Here, we have noticed that roughly 40% of all the cases, all the tested positive for COVID-19 are Latinos. What other measures the county is considering to have more information in Spanish? Because we have noticed that the majority of our Latinos are monolingual. They just speak Spanish. Also, they don't have dexterity to manage internet websites. So what other alternative the county could offer to this community?
Well, Jackie, I want to start out by thanking you for what you're doing to make sure that the Spanish-speaking community gets information. This is a priority for us. And I know that you've been making videos to share information, and I want to thank you for that and thank El Punto for being a resource for our people so that we can share information with all of the people of Mendocino County. And I also want to thank George, who I know has been working very diligently to make sure that we have our information translated so that it is available in Spanish. But we can always do more. So I know that our PIO, who's Sarah Duquette, our public information officer, this remains a priority for us to be sure that we're communicating with all of the people in our county. So I would ask that if there's feedback that you can give us specifically about how we can do a better job, please give that to us because it is a priority. I also do want to say that for our the Hispanic community that has tested positive for COVID-19, there is one of the resources that we have. With Latino community populations of people, often we have large families that are living together. And I want to thank those people that have had COVID-19, that they have taken up our offer to have isolation housing. So sometimes when you're in a household and you live closely together, you might not be able to isolate in your household because you're a close family. And so we have housing that we've been able to provide so that if one family member has COVID, they can go and recover in their own motel room is what we've done. So the rest of the family stays safe. And I just want to really thank those people that have had COVID-19 who have done this with us, because it's been a way that we've absolutely been able to contain those outbreaks. We haven't had any outbreaks resulting that we're aware of from those families. So it's been very, very good. And we're really grateful for that. So I would ask you, Jackie, that you could share with George any ideas that you might have of how we can do a better job of sharing information. And we want to do a better job but we do, I will mention on our website, we do have translations of our orders into Spanish, and we do have signs that are in Spanish, but please let us know how we can do a better job.
Ok, en primer lugar, la doctora agradece enormemente el rol que está jugando aquí el periódico Al Punto por toda esta información que está haciendo llegar a la comunidad hispana en el condado de Mendocino. Asimismo, ella abre las puertas a Jackie y a otros miembros importantes de la comunidad que puedan darnos ideas de qué manera podemos mejorar nuestra aproximación a la comunidad hispana. Ella está abierta a diferentes posibilidades y que pueden ser canalizadas a través tuyo, Jackie, o a través mío. Igualmente, ella ha podido verificar que las personas que han resultado positivos, las personas de origen hispano que han resultado positivos al COVID-19, han jugado un rol importante en controlar la pandemia. Todos ellos, algunos de ellos han aceptado incluso salir fuera de sus casas para poder alojarse en un lugar distinto para garantizar la salud de la familia y la salud de la comunidad. Y también ella ha podido identificar que los casos identificados en estas familias no se han repartido, no ha habido más contagios a partir de ello, lo cual implica un compromiso de parte de nuestra comunidad en esta lucha que estamos haciendo contra la pandemia. Y ella insiste que ella tiene las puertas abiertas para ver de qué manera nosotros podemos mejorar nuestra comunicación y el acceso a la información a la comunidad latina en general.
Jackie's muted.
Jackie, you're muted.
Ok, gracias. Mi segunda pregunta es con respecto a la reapertura de los hoteles. Ahora que se van a reabrir los hoteles, la mayoría de la gente que trabaja en los hoteles como housekeeping son personas latinas que son monolingües y que solo hablan español. ¿Cómo el condado se va a asegurar de que este personal que trabaja en los hoteles estén debidamente capacitados para hacer los procedimientos correctos? Estamos un poco preocupados debido a que existe el riesgo que las personas que estén en contacto con ropa contaminada con riesgo biológico, como lo pueden ser las sábanas y las fundas de las camas.
Okay, now that we are starting the stage 3 today, that lodging are going to open, so we are concerned about the housekeeping and cleaning staff in these hotels and lodgings. There is any idea in which we can train these staff about how to handle biohazards for potentially contaminated bed clothing and towels?
Yes, thank you, Jackie. That is such an important question. And the guidance that has come from the governor about opening lodging, which you can find on the State of California website, has quite a lot of detail in it about the safety, protecting the safety of workers in hotels. So I would direct you to look at that guidance from the state. But this is also why I made as a requirement for hotels that they keep a 24-hour period in between guests so that the house cleaning staff doesn't have to rush through the cleaning. And the guidance from the governor says that house cleaning staff should not be penalized for going slower with their cleaning than they might under normal conditions, so that the house cleaning staff can be protected. Now, COVID-19 is, it's spread by droplets. So think of it like spit, that comes from the mouth or from the breathing that would fall on a surface. So if you wear a facial covering and you wear gloves and you're cleaning, it should be safe as long as you're practicing good hygiene. And there's guidance in the governor's directions about lodging that gives specific recommendations about the cleaning. Now, in the order that I have, vacation rentals actually have a 72-hour period before they can be occupied to allow more thorough cleaning and to recognize that a vacation rental is an entire house, potentially with a kitchen and bathroom and many different elements to it. So it'll be more complex to clean, and there would be more people potentially in that vacation rental than a hotel room. I did put limitations in the number of people that could be in lodging to 2 adults and their children. So we're not going to be seeing during this order large parties or gatherings being in vacation rentals. So this is part of the way that I'm protecting the workers that are going to be cleaning these environments to make sure that there's not crowding in them and that there's plenty of time for the staff to do the cleaning well and while protecting themselves without rushing.
Okay. De acuerdo a la ordenanza estatal sobre la apertura de hoteles y lugares en el cual no se puede alojar, ahí especifica cómo es que el personal que hace limpieza y maneja esta ropa de la habitación, digamos, ahí establece una guía, cómo se deben seguir para poder garantizar la salud también de los trabajadores. En esta guía establece que entre un cliente que vaya a hospedarse y el siguiente cliente debe pasar al menos 24 horas, y en centros de vacaciones, en centros vacacionales deben pasar hasta 72 horas para permitir el cambio y la limpieza de cada rincón de la habitación o de la casa que se haya estado rentando. Porque básicamente el contagio de este virus es a través de las gotitas que nosotros eliminamos y que pueden estar en las superficies de esa habitación o de esa casa. Entonces ellos tienen que tener el tiempo necesario para poder hacer la limpieza. Igualmente también la protección. Ellos van a tener que estar usando guantes, mascarillas, para también protegerse ellos mismos y no salir contaminados después de esta limpieza.
George, ¿y el condado se va a asegurar de que las personas que trabajan en los hoteles y que hablan español vayan a estar debidamente capacitados en el idioma o que entiendan realmente el proceso?
Okay, Dr. Doohan, she's asking if the county is going to make sure that all the staff that just speak Spanish is going to be trained and know this new order in order to keep them safe.
Yes, the answer is yes. And this is through this process of self-certification and having a site-specific protection plan that we're requiring of the higher risk businesses. This is what has come out of our collaboration between the Board of Supervisors ad hoc, Supervisors Jurdy and Williams, as well as the West Company that is working with the business community to make sure that they open safely, not only for the customers that come into these businesses, but for the workers that work in the businesses. So this is the responsibility of the businesses, and they have to certify and also come up with a protection plan to make sure that their workers are protected from COVID-19?
Ok, la respuesta es sí. En estos momentos, los hoteles o los centros de alojamiento que quieren abrir tienen que pasar por un proceso de autocertificación. En este proceso de autocertificación, ellos tienen que garantizar de que tanto los clientes como el personal cumplan con todas las directivas. Ahora, en este proceso de autocertificación, el consejo que rige el condado, de manera conjunta con West Company, ellos han ideado alguna forma para que todas estas empresas que reciban el apoyo y garantizar la salud de los trabajadores como de los clientes que vayan a tener.
Okay. Gracias, George. Thank you, Dr. Doohan.
Yeah, and I want to say that we take time with every media day on Friday to make sure that we have Jackie and George to have time to ask the questions in Spanish and to interpret those, so that we are showing our commitment to our Spanish-speaking community, and that commitment is strong. So thank you very much.
Thank you.
Thank you.
Thank you. This has been the Friday COVID-19 update. We'll see you again next week at 2 p.m.